Good evening and welcome to another community conversation sponsored by BSBA. My name is Laureen Pryor and I will be your moderator tonight as we discuss with medical professionals, the Black community, and the COVID-19 vaccine. Now, if a lot of you are like me, then we know that we are super skeptical of any time somebody talks about a shot and then they trot out different Black people trying to say this is the thing for you and it's okay. But tonight we're going to get to it. And we're going to ask some medical professionals about the COVID-19 shot. And before we get into that, we have to know who we're talking to. So will you please welcome Dr. Stephen Noble?
Thank you, Maureen. It's a pleasure to be here. Thank you for having me on this panel. I'm extremely excited to be here. My name is Dr. Stephen Noble. I'm a cardiothoracic surgeon here in Portland, Oregon. I also serve as a healthcare consultant and a healthcare executive, angel investor, and lead medical advisor for LiveShare Health, which is a Black-owned healthcare startup company looking to leverage barbershops and hair salons, that trust that we have in those members of the community to reimagine healthcare for the Black community. I'm also an author of the children's book, The Heart of the Hero, the Dr. Daniel Hale Williams story, and associate producer for the documentary Black Men in White Coats. Again, it's a pleasure to be here today.
I always love seeing you, and every time you come through with something new with your hair, I'm digging it. Welcome to my party. Next, we're going to welcome Dr. Joby Morrow.
Hi, everybody. My name is Joby Morrow. By training, I'm a family medicine doc and a psychiatrist, and I've been working as a healthcare consultant for the last 3 years. And one of the things that I have been doing recently is consulting on a new telehealth company that specifically focuses on coronavirus and its potential vaccine symptoms. And so that's a telehealth company that I've been doing a lot of work with. It's been a lot of fun doing that. And I've also been recently working on a book on how to view racism as an addiction. And that's been also a lot of fun. And that is going to press later on this year. Thanks so much for having me. Great to be here with you again, Laureen.
Fantastic. Welcome back. I love the fact that you're still going in this medical thing because we got some questions for you. So sit tight. Next, let's talk to Dr. Fields Gilmore. Welcome back.
Hey, Laureen. Thank y'all for having me. I am coming in from Texas. So y'all have heard a lot about Texas in the last couple of weeks. It's a lot going on. I'm a family medicine physician. I teach medical students and work very hard in the primary care setting in an underserved community here in Houston. I'm also a mom and a wife and a quarterback for my family. So got a lot going on, and I have a lot to impart and hopefully can answer some of y'all's questions. So thank y'all for having me.
Perfect. Well, welcome back. I'm glad to see the lights are on and that you're warm. So.
But you know that mask mandate is about to be over tomorrow, like at midnight.
Oh Lord. Well, we yet praying for you. For you. Welcome back. And we're going to round out our panel with Nurse LaShawn. So welcome. Go ahead and introduce yourself.
Thank you. Good evening. It's awesome to be here. I am LaShawn Dorsey. I have been a nurse for over 23 years in labor and delivery. That is my specialty. I'm also a wellness coach. My focus is bringing wellness to our people, to colored folk. Highest disparity, we die hard, fast, and quick. So we need information. So that is something that I love, I'm very passionate about. Yes, I have a degree in public health, medicine, nursing. So I'm here for the people, and I'm here to be a part of this awesome collaboration. Thank you for having me.
Perfect. Well, thank you for coming. And I love that you said you here for the people, and that's what I'm about. I'm all about the people. So thank you for coming and agreeing to share your expertise with us.
Thank
you.
If
we can get all the panel up, because I mean, every time I look at something new, a lot of folks are talking about a lot of things. And, before we got on, we were kind of rapping a taste in the background. And we started talking about the Tuskegee Experiment and how that contributes to the mistrust that many Black folks have in medicine as a whole. So you guys were kind of straightening that out for me. So what are the misconceptions when it comes to talking about the Tuskegee Experiment? And I will start with Dr. Fields Gilmore. What is something that you think needs to be cleared up?
Okay, so I heard this from my patients. I heard this online. I heard this on the radio, and people are saying that with the Tuskegee experiment, that the patients who were involved and the people who were involved were infected by the doctors and the nurses, and then not treated. So that's not exactly how that went. Those people who were being experimented on had syphilis already, and then they weren't treated. So they were being observed to see what the disease would do, what was the disease progression, and they weren't being treated. So that's a little bit to clear that up.
Okay, so when you say that they just weren't being treated, so basically they were being used as guinea pigs
Yeah.
to see how syphilis, I guess, matured or spread or.
It is as horrible as it sounds. It's like what I did when I was in the lab and we had rats. You know, you watch to see what happens to that specimen or to that, to that particular entity that you have given whatever said disease or to see what happens so that you can document it so that you have information, and then you're supposed to treat. You're supposed to have a group that you treat and a group that you don't treat. It's a whole thing, but that's what they were doing then, was observing those human beings who had the disease and allowed the disease to take over and not treat what would happen. And to be honest with you, I haven't read about it in so long. I don't know. I don't remember if they even got treated, but I know a lot of people died.
Okay. And so would it be fair to say that this was the control group that was used so that they can, use the treatment or for other folks, not Black folks? Would it be fair to say that?
Go ahead, Joby.
Lorene, I don't think it would even be fair to say that, because penicillin had already been identified as a treatment for syphilis very early in the study. So by the time that the study was 5 years old, the study lasted for 40 years, as many people know. But by the time that study was 5 years old, penicillin had already become the standard of care for syphilis treatment. So that wasn't really the reason. And part of the reason why this study was so unethical is because the Black people that participated in it were led to believe that they were getting treatment. They were getting blood draws, and they were getting lots of other medical care for other conditions, but not for syphilis. And so it has the same sort of quality as any really, really good lie does, which is that it's sort of wrapped up in enough truth and enough other kinds of goodwill and virtue that it seems believable, and it gets insinuated into the fabric of other really good things. So it's a lot harder to detect that it's a problem. So that was the issue, or at least that was one of the issues. There were many, but that was the main one. And that is, I think, probably the heart of why it has permeated and sort of lasted in like our emotional space for that long, is because it's such an abuse of trust, and that it's really become kind of a proxy for the larger issues that we have as a community with trusting our medical system.
Right. And so traditionally, the way that things get around in our community, there are stories passed down. So why do you think this story has kind of had such a lasting, like a shelf life, if you will, a lasting type of shelf life in our community, Dr. Noble?
I think two reasons. One, this was a study in which it was sanctioned by the government. So you have government sort of involvement. And then two, I think because of Tuskegee itself, here's an institution that is allotted, historically Black college university. And I think in a perverse way, when you want to be able to subjugate or keep a group of people down for a period of time, what you do is, you sit up here and take that institution, which is supposed to be a place of trust and heralded, and you associate a negative sort of, aspect of history with it. And Tuskegee is a bastion of, historically Black colleges and universities. And one of the reasons as to, some of us are on, or while we're on this panel today, as far as what Tuskegee has meant in the Black community, as far as producing physicians. And so it's unfortunate that Tuskegee does get this negative connotation. But for that reason alone, just when we think of just negative aspects, they, attaching it to that great historical university, unfortunately, has created a double-edged sword for us.
And Nurse LaShawn, I know that a lot of times, again, when new vaccines come out and new treatments come out, Black folks are just kind of like, nope, Tuskegee, nope, Tuskegee. Is there anything that you see that could help with maybe, getting folks more comfortable with really looking into some of these other things that are coming down the pipeline?
Well, definitely one of the things is this conversation. I think conversation, communication, and information, because one of the things with the Tuskegee, they didn't have informed consent. And so it took that right away. And so as long as we are informing our public, our community, giving them information and then questions, giving them a platform to ask those hidden questions. Because sometimes our grandfathers, our grandmothers, our aunts, our uncles, my mother, they don't want to talk about that. So giving them that platform to share, to help shift their mentality, their mindset into making an informed decision. We're not trying to push anything on you. We want you to have the information so you can be informed to make the correct, best decision for yourself. That's something that wasn't given to the Tuskegee men. That wasn't given. So I would say that piece, that collaboration, what we're doing right now, very beneficial.
And so, when we talk about this vaccine in particular, COVID-19 has ravaged our communities, yes. And they have continued to, wreak havoc and the pandemic, along with other things that are happening. So I just have a question for y'all. Who is taking the vaccine? Who has taken it or who will be taking it?
So like I shared while we were talking behind the scenes, I got the vaccine, but I was very hesitant to get the vaccine. And I did a lot of reading and talking and consulting with my colleagues and other professionals. And Dr. Hildreth was one of the people who sat on the FDA board during this development and pushing this thing out. And he hails from Meharry. So I sat in on a meeting with him and I was able to ask him direct questions at the time when it was being rolled out in the beginning of December. I was still breastfeeding my now 14-month-old child. And so my concerns involved breastfeeding, involved pregnancy, it involved, all of those things. And I was very hesitant about it. However, because I know I have asthma. So I was like, I just had this baby. And because I am a healthcare professional and because I'm a primary care physician, a family medicine doctor, I'm going to come in contact with this. And if I get it, it's going to take me out. And who's going to take care of my child? So at the end of the day, I just, even though I was hesitant, I said, you know what, I'm going to sacrifice this for myself, but also for my son and for my husband. So that's how I came to that decision. And so I was honest. I was one of those Black physicians who took the picture of myself. I didn't take the picture of them putting the vaccine in my arm, but I had my face shield on and my mask. But I was honest about what I posted on Facebook about, hey, I was concerned. I did all the reading I possibly could. I tried to get in all the professional meetings that I possibly could and gain all the knowledge that I felt like I could to get comfortable with the idea, because I'm doing these things and I'm providing nourishment from my body to my child. So I could get comfortable with it and go ahead and do it, because it's the devil the devil you don't know. What do you do? So that's what I did.
So let me ask you this, and before anybody else answers. So I know that there are 3 different vaccines out: the Pfizer, the Moderna, and now Johnson & Johnson released their version over the weekend. So which version did you, if you're comfortable with telling us, which version?
The Pfizer.
The Pfizer. Okay. Did anybody else take the shot? Anybody else?
I did. I've I've taken the first one, so I'm new, and I'm like Dr. Fields. I believe I was like I'm not sure about it. Let me do some research. Like 60% of my unit had taken it, and it wasn't required, but they were definitely recommending it and making it available to you in the hospital and different sites. And so I definitely researched and just was trying to figure out which way do I take it, do I not take it, but I'm in a high risk environment. And I'm an example, my mom, who has, she has asthma, she has different things, and then my husband and sons. So I just felt like the responsibility, the benefits outweighed the risk once I was informed with actually which one I wanted to take and just the process of it. And then I watched a couple of other people, their signs and symptoms, what they went through and things like that, just gauging it. So I just took it like, I think a week and a half ago, my first shot. So,
and what version of the shot was it?
I did Pfizer. Pfizer was available at the time.
And Raymond said he needs that Johnson & Johnson one hitter quitter. I mean, so the question that I see, it says, are we able to determine which brand of the vaccine we would like to receive, or will it be up to the doctor's discretion?
The doctors don't choose. It's whatever's available at that facility.
Okay. Whatever's available at the facility. So with the three, okay, so wait, hold on. Before I go on, gentlemen, have either one of you taken the shot?
I have not taken the shot, and I'm with Raymond. I'm going to anticipate getting the Johnson & Johnson vaccine. From the beginning, I said that I was not going to be one of the first individuals getting the vaccine. I'm not an anti-vaxxer, but I am one that is, I'm deliberate. And I think that when we talk about this question of vaccine hesitancy, it's one of vaccine deliberateness. And I think that all of us have been in vaccine deliberation ever since that this thing came out. And so you see individuals like Dr. Fields Gilmore, LaShawn, we are all sitting up here doing our research, educating ourselves to this, because again, there's individual decisions that we can make. And yes, we can sit up here and make some blanket statement, but there's individual health concerns and conditions. For myself, it was really a matter of, I wanted to see how this vaccine reacted in actual, the real life setting versus what it was in the study. Yes. And so I think what we do in the study, which is very controlled, versus what happens in real life is totally different. And so I wanted to see come around March, April, we would start to get some of that data that we're now starting to get as far as how things went for the healthcare workers that initially got it. I am one that I don't like shots. And so I do appreciate a Johnson & Johnson vaccine and think that this can be a game changer for our community, especially as it relates to the cold storage, the processing, and the transmission. And the fact that you don't have to worry about someone coming back for that second dose. You don't have to worry about people being concerned about what's going to happen when I have to give you my information to come back to get that second shot. So that one shot vaccine is very good. Plus, this vaccine was conducted during the time in which we had some of these variants. And so I think when we sit up here and look at the vaccine, I can understand how people can get led astray or misconstrue some of the data and the numbers. At the end of the day, just get the vaccine that is available to you and get the vaccine according to the manufacturer's instructions. Meaning, if you get a Johnson & Johnson vaccine, you're good to go with one shot. If you happen to know that you're getting a Moderna or a Pfizer vaccine, know that you need to go back for that second shot. But regardless of the vaccine, get whatever you can get, because it's very difficult to get that vaccine right now.
Yeah.
So I've been reading some things now. And so before I do tell y'all what I've been reading that has me like, no, that's not for me. Dr. Joby, have you gotten the shot?
I have not, but I will. Okay. And the reason why I have not gotten it is because I don't do direct patient care. Because I've been in healthcare consulting for all of this time, I've been able to work from home. And that's, of course, been a wonderful blessing that a lot of people in our community don't have. So part of the reason why COVID-19 transmission was so bad in our communities in the first place is because we are disproportionately represented as in service and essential work. So so we have a lot of folks who are in service sectors who were having to load public transit and be in places that where they were working face to face with other people. And often in hospitals where, they had to face higher loads of virus and thus got sicker, and among many other reasons why the illness was more severe in Black people to begin with. So, I am a real advocate for vaccines for the most part. And, one of the reasons why I am is because when I hear people talk about like how they are worried about whether or not these vaccines are there to kill Black people, well, COVID-19 is killing Black people. And that is something that it has done with alarming efficiency. And so, if we're able to get effective prevention against it, then I want that for our communities, and I want us to be able to have this option so that we can reopen our some of our most sacred institutions. Our churches, our businesses, our shops, our barber shops, our salons, and the businesses that tend to power Black communities.
Gotcha. And so while we're waiting, while before we move on, I want to encourage the audience to go ahead and continue to submit your questions. We will absolutely get to them. This one says, what I don't understand is how anyone can do research on something they've never encountered before. What's being studied? I'm seriously asking. Thank you for your question, Michelle. Dr. Fields Gilmore.
Let me chime in on that one because I saw that pop up. So how can you do research? Well, first of all, I'm sure maybe you haven't heard, but the technology to use to make this vaccine was already in play. They already had a lot of the technology in play. They'd already been doing things with it. And so that was one thing that I researched and said, okay, that makes sense to me, but that's because I am a physician. So I have a little bit of information about that already. So I said, okay, that's fine. But then the other research that I did was making sure that not only did I read some of the journals and things that I had access to, but also because one of the things that I saw was, okay, there was this discrepancy. Women breastfeeding and pregnant women can get the shot. Women breastfeeding and pregnant shouldn't get the shot. And that was from Pfizer. Pfizer initially was saying, don't do it because we don't have enough information. But then as time went on, and even ACOG put it out there, which is the American Academy on Gynecology and Obstetrics, said, yes, it's safe to do this. So that's when I say I did research, I looked at different academies, I looked at different medical colleges. And when I say medical colleges, I mean the American Academy of Obstetrics and Gynecology, this academy, pulmonology, since I have asthma. Okay. And then I had the opportunity to sit in on a talk, like I said, with Dr. Hildreth, who sat on the council during the development and push for this vaccine. He's on the FDA council. And he's a president or higher up at Meharry Medical College. So he's an African American. We had a private meeting, and we were able, and this is something that I had access to that other people don't, and I was able to ask direct questions of him. So getting all that information and being able to make an informed decision and feel a little more comfortable about me taking the shot because I was breastfeeding. That's what I say when I said I did my research, because it's true. We don't have any information about the long-term effects. But like Nurse LaShawn said, you have to look at the benefits and the risks and see what that weight is for you. Do the benefits outweigh the risks for you? And Joby touched on this with our African American community and our Latino community, right? A lot of them perished. A lot of them are still very sick. Then a lot of them have residual effects because we have so many underlying conditions. Absolutely. If you have an underlying condition, then that's something you need to seriously consider. And that is a part of your benefit risk ratio, and whether or not that benefit is more than the risk, and whether or not you're going to get the vaccine.
Okay. Thank you for that. The next question, and I would go around, but I don't want to run out of time while we're trying to answer these questions. So the next question is it normal for a vaccination to be produced in a year or less? Is that normal?
No. Steve, I saw you. But let me just say this because I've got some info about this. So no, it's absolutely not normal for a vaccine to be produced in a year or less. This is a record time from the time of an onset of a disease to having a vaccine for it in essentially a year and a half. That is a year. So that is by far and away a record. Here's how they did it. So normally when you are producing a vaccine, what you do is you study animals. So you produce like a method that you think is probably going to work, that's going to sort of trigger your immune system to produce the antibodies that it needs to fight off a disease. So you figure that part out, and then you test it in animals, and that you often takes a year or two. And then you test it for safety in humans, and that often takes a year or two. And then you test to see whether or not it works, and that often takes a year or two. What they did to produce these vaccines is basically did all three of those steps at the same time. And so the way that they were able to make that work is by stacking all of the usual steps that would normally be done in a sequence and would often take a couple of years. And now we're able to produce something in about 9 or 10 months. It's a remarkable strategy, but it comes at a little bit of a cost. You don't get this sort of long-term benefit data that you would normally get. So we don't have the same type of data that we would normally have about whether or not a vaccine of this type of caliber is effective long-term. So we don't know that as much as we would a vaccine that was produced in sequence, because some of those earlier, if you did it in sequence, then you would be able to sort of study some of those earlier animals and people that got it, and you'd be able to track them. So that's our trade-off. And we had to have a trade-off there. The trade-off in doing it in sequence was that it takes a long time to develop. We didn't have time. So we took the trade-off of basically not knowing as much about the long-term efficacy, the long-term effectiveness of the COVID vaccine that we have currently.
Okay. And so with them rolling out different versions of the vaccine, are they looking at different strains? Are they looking at, why are there 3 different vaccines?
It's a first one to the mark. And so part of this is just, it's a race to find a cure or ways to get out of this pandemic. And so part of, medical ingenuity is healthy competition. And that's exactly what you had. Healthy competition as far as which developer was going to be able to get to, the finish line first. But at the same time, you had just a plethora of individuals invest into the whole R&D development of this process. And one of the reasons as to why this happened so quickly was because the amount of money that flooded into the R&D research and development of these vaccines. And so why you have, Novavax is another vaccine company that's, out of Maryland that should be coming out pretty soon with the vaccine. One of the reasons why you had all these AstraZeneca, Novavax, Johnson & Johnson, Pfizer, Moderna is who could get there first, who could help us get out of this pandemic. And so these vaccines are all different in very nuanced sort of ways. But at the end of the day, all the vaccines that have been released or received EUA authorization here in the United States all meet the standard of care, which, in the end was going to be greater than 60%. Honestly, we were going to accept anything better than 50% of preventing severe COVID-19, because at the end of the day, that's really what we were looking at. We weren't looking at, all these other sort of sometimes what we call esoteric side effects, or does it do this or does it do that? We were really looking at, can this vaccine prevent severe COVID-19 infection and or death? And so these vaccines do that. And so now we have 3 vaccines in the US market to be able to choose from, or to be able to receive the vaccine from.
You gave an acronym, EUA. What is that?
Emergency use authorization, meaning COVID-19 was so bad that we needed to hurry up and get these vaccines out, and we weren't going to go through the tried and true regulatory process that takes months to years sometimes to actually get through that process.
Gotcha. This next question says, I have been hearing if you have allergies, you're likely to get very sick. Is this true or not? And I don't know who wants to take that.
So as far as the reaction to it, It depends on how you react to things. So, like I was telling the group before we got on, I had to sit for 30 minutes. So the picture that I took of me after I got the vaccine is me with my face shield on and my mask, and I'm sitting in the little blue chair, so they could observe me for 30 minutes to make sure I didn't have a reaction because I walk in a bubble. I have my EpiPen, I have my Benadryl on tap. So if I have a reaction to something, I can try to start saving myself. Oh, and my inhaler, I have my inhaler. So it depends on what your level of reaction is. It's kind of like when you ask if somebody has allergies to eggs, if they're going to get the flu shot, right? So it just, you have to know what your level of reaction is whether or not you're going to have a reaction to that. And let me just say this, because I know Lorene said she was going to ask, but I'm just going to put it out there and segue into it. Yes, I had muscle soreness when I got the shot.
I did.
Other people had fevers, chills. I don't know how LaShawn responded to it. So it depends on what, and for me, it lasted for 48 hours. And why did I have the muscle soreness? Because I started exercising and I was already sore. And so it kind of amplified the soreness that I already had. I didn't have the fevers and chills. I didn't get the headache. I didn't get anything else. I had just really bad muscle soreness and forgot that I could take a day off and went to work and was walking like a hunchback for a whole day at work. And then it went away, right? So other people have had other symptoms, but it goes away between 24 and 48 hours.
Okay.
Yeah.
And Nurse LaShawn, you seem like you want to jump in there.
No, I only took the first one, but they are saying the second one have more of effect, more side effects. But my arm was very sore. It got a little swollen a little bit. And then I was very tired, like an hour after I took the shot, because I went right back to work. And that lasted maybe 12 or 14 hours. But after that, I was fine. I'll see how my second shot go, though.
Okay, I'm gonna check back with you after that second shot.
And it is normal to have that reaction, to have that second shot cause more symptoms, because it is exactly what you're trying to induce your body to do. You're basically trying to train it to recognize the virus on site. And when it recognizes it on site, it creates a reaction. And so the second time that it gets recognized, it can create a much bigger, swifter reaction to be able to create the antibodies. But of course, when you create a big, swift immune reaction, like a fever or any other sorts of, or like chills and things like that, it does, you'll notice. So when you have symptoms, it is often your immune system that is creating it rather than what infected you to begin with, that your immune system is fighting off.
Yeah, you said infected. That's a good word. Hold that word. This person says, is Walgreens as safe as going to the doctor to get the shot?
Oh, yeah. Yes.
They say yes, Rob. You go.
Yeah.
Go ahead.
I'll go to Walgreens. If Walgreens is giving out the Johnson & Johnson vaccine, go.
Yeah. They give out the flu shot.
Let's see. This one says, so technically taking the vaccines are a gamble with our health, since typically we would need to have years of research to prove that it actually works. Is that?
I would say that being a black man, being a black woman, going into the healthcare system with COVID-19 is a gamble of your health. And so we got to look at our sister, Dr. Suzanne Moore, who was, a black physician that knew she had COVID-19. Was in the hospital telling these folks, this is what you need to do. I'm having shortness of breath. And if we can't protect her, if we can't protect her, we're all going to sit up here and struggle. So I think that we really have to reimagine or rethink what we're really sitting up here saying, are we taking a gamble? I would rather take this COVID-19 vaccine may be the one and only vaccines that we can sit up here as black people and take and prevent us from kind of dealing with some of the negative aspects of getting into a healthcare system that wasn't necessarily created for us. And so if you can get the COVID-19 vaccine and not have to go to the hospital because of shortness of breath, or not go to the hospital and have to worry about people not listening to your very vague symptoms, your loss of smell, your loss of taste, and then you sit up here, hours to days later or on a ventilator, we got to sit up here and think about what's going to be the bigger gamble, knowing how we have historically been treated in a healthcare system that wasn't built for us, or this vaccine that is 95%, or anywhere from 60 to 93% effective from severe COVID-19. I've taken a while to kind of get to the position where I'm at now, that I'd rather go with the vaccine because I know how they did my sister, Dr. Suzanne Moore. I just don't want to go out like that.
And so when
to say, Dr. Suzanne Moore, it broke my heart. She passed away, and she had to be moved from one hospital to the other, and she was in Indianapolis, Indiana, if you want to look it up, and that's where I trained for medical school, and broke my heart because she was telling them, and she actually did FB Lives as she deteriorated.
Yeah.
So, for me, it's like, I'm not gonna try to cram it down people's throats, but you gotta know that as a person who's taking care of people and watching this happen, it's heartbreaking. So if you, again, I put it, I just say it's risk benefit ratio.
Right. And so when you're talking about not being subjected to a system that has historically treated us in a way, I could push back and say science has been the same way. And so what do you say to folks who are like me and say, well, science has been hostile towards Black bodies too?
Yeah.
So how would you, because I heard the risk and it makes total sense, Dr. Noble, don't get me wrong, but historically, science, the field of science has also been hostile towards Black bodies. So why should we trust the science in this case?
So, I mean, at all due respect, and I hate to, a plug for my book, The Heart of the Hero. But when we look at science, when we look at the history, one of the first individuals that created an interracial hospital because he realized that Black people weren't getting great care was a Black man. So a lot of the great advances that we have in healthcare and in science is because of Black people. And so when you have Black people involved at the decision making of a lot of these things, you can sit up here and trust the science. I trust my colleagues, not because of what the CDC said, the FDA, or Anthony Fauci. I trust the colleagues that are in the National Medical Association, the HBCU graduates that I know that went to Xavier, to Meharry, to Morehouse, to Howard. Those are the individuals that have gotten the vaccine, and those are the individuals within science that I sit up here and trust. And these lauded institutions, again, the CDC, the FDA, a lot of these other institutions in this sort of format have let us down. But thank God to the American Medical Association, the Association of Black Cardiologists, and the host of other individuals, Black and brown individuals within science that have done the work to sit up here and say, you know what, this is our best chance in conjunction with masking up, hand hygiene, and social distancing to really get a handle on this pandemic.
And I hear you. I mean, I don't know your friends. Maybe I can meet some of them one day. But I do know they were putting Dr. Kizzy out there. And, going to her Twitter, she was cutting up and she was talking very derogatively about Black men. And so this is the person that was leading the charge. And she basically said Black men are worthless and she's going to be with all these other men. And so if that's the best that they got, I don't want no parts of it. And I'm be honest with y'all. So I don't know your friends. Maybe y'all can introduce me one day. But I'm still struggling with the things that we know that have been passed down historically through our community. And then I don't have the background that you all have to trust these folks that you all trust. I don't have that. So how do you all kind of talk to people like me who are just saying, nah?
So I think one of the things that is kind of an unfair burden to everybody is that a Black physician often has to become like the face of a community and also has to be the face of authorities. That is kind of an uncomfortable position. So Vice President Harris is kind of in this position now where she is basically being asked to be the sort of a champion for a system that has really sort of neglected her people and abused her people. And so that's a problem, right? Because like not only are the optics bad, but also it puts her in like this kind of weird kind of codependency situation that isn't really not healthy for anybody. Mm-hmm. So one of the things that I think would be helpful from the public health and scientific community standpoint is to just acknowledge the history and to maybe even talk through some of the ambivalence that people might feel when they're in those clinic visits or when they are in these forums, and to not deride that ambivalence, like not to knock it and say like, you take this vaccine because we need you to take it. Like that's, that approach never really works. It doesn't work with your kids. It doesn't work when you talk with your colleagues. It's not going to work with in society. And so to be able to just give some space and say, hey, I bet you got some questions. And I'd love to hear about what your feelings are. And I'd like to hear about what it is that your thoughts are about taking it. I'd like you to be as honest with me as you feel like you can.
Can I say something? So I'm in Houston and I work in Sunnyside, which is Southwest Houston, and it is the hood. Okay. And we have my population, my demographics are African-American, primarily African-American and Latino. And I can say this, that when the vaccine first started rolling out, a lot of my patients, both demographics, the African-American and Latino, were resistant, didn't want to get the vaccine. But now I see they are like, hey, Dr. Fields, can you sign me up for that vaccine? Y'all got some more vaccine? You got any left? And it's I just talked to two of them today. Dr. Fields, I got the vaccine. I signed my wife up, and these are Black men.
Yeah.
So it just warms my heart to see that it's changing, and a lot more people, even Rob on here said he's going to get that one hit or quitter and get the Johnson & Johnson vaccine, and he's a Black man. So it warms my heart to see that it is starting to catch on. And I think the more that we have these discussions and we talk about it, because we still have the trauma as a community, we do. But I think it's important that we acknowledge, yes, there is trauma. And hey, I talked to them back in December and they was like, nah, I ain't doing that. And then now they asked me, do we have any left? Right? Mm-hmm. I'm not jamming it down your throat. I got it. I got it. And so if you want to get it. Let me know. I'll get you hooked up.
That's it.
The other thing is we don't need everyone to get the vaccine. What we need is herd immunity. And so herd immunity is going to be 60 to 70%. The scientists think we need about 70 to 80% effectively for herd immunity. So if you look at this panel right here on your screen, if 3 or 4 of us get the vaccine, you don't have to get the vaccine, Maureen. You should have necessarily herd immunity. So, but I say all that to say you still need to wear a mask, you still need to wash your hands, and you need to socially distance. But what you're gonna find out is that as more and more people get vaccinated, vaccination is going to be that key to being able to do some of those things that allow you to go back to your life. So if you're sitting up here working, as Joby mentioned, a front-facing job, but your child has come home sick with COVID-19, you're going to have to stay home because you're not vaccinated. However, if you were vaccinated, the CDC says now that for the guidelines, those that are vaccinated that have been exposed, but they're asymptomatic, can go to work, can do all these other things. So it may be what is the worst case scenario or the economics for some of us as to why we should or should not get vaccinated.
Yeah.
Right. And I wanted to go back because Dr. Joby, you were talking about Black physicians being the face, but I know before we started this conversation live, Dr. Noble, you were talking about LeBron James and his personal decision not to kind of reveal whether or not he's going to take it. And so I don't know, did you want to elaborate a little bit on?
I think Joby mentioned it very poignantly from the standpoint. I think that as individuals, yes, we all have, individuals can have platforms. We cannot necessarily, we can't speak for everybody, as Black people, as a one Black person, you can't speak for, all Black people. And I think that where LeBron James and this personal issue comes into play is just really healthcare. And again, he's used his platform for other things, which is fine. And I think that there's this push for him to sit up here and to, roll up his sleeves and have individuals take photos of him getting the vaccine. But he's making a personal decision for him and his family. And I perfectly agree with that. And I think as a healthcare provider, we all sit up here and want our patients and just people in general to be able to have the autonomy to make their own decisions, give them all the information that they need, and make the best decision for them and their family. And so I support LeBron James in doing exactly what he thinks he needs to do for him and his family.
Because it ain't nobody's damn business. That's why. So, Dr. Joby, you were talking about the misconception that vaccine hesitancy is a Black thing.
Yes. Yes, I was. So one of the real frustrations I've had is that, as you had mentioned and Selena had mentioned in the BSBA, that Black people also became the face of COVID-19, and also Black people have managed to become the face of vaccine hesitancy, meaning like, having some ambivalence about whether or not they are going to take it. And a lot of that comes from a November 2020 Pew Charitable Trust survey that showed that 80% of white people surveyed were planning on taking the vaccine. About 60% of English-speaking Asians and English-speaking Latinos were going to take it, and 46% of Black people were going to be taking it. So those were the groups that they studied, those four, and they probably had about 500 people. So it was a really small survey for one. So that was one, and subsequent surveys have not borne that out. So that's one issue. The group, when you study this in a much larger sort of setting, like where you study more like 7,000 or 8,000 survey respondents, the people who are most likely to have vaccine hesitancy are white conservatives.
Well, there's more of them. Duh.
Well, there are more of them. That is absolutely true. And they are also more that is the group that's more likely to work from home and already to have sort of conditions that lend themselves to social distancing. They live in exurbs, and they live in rural communities that already tend to social distance just as a matter of living. So that's, that's a little bit of a frustration for me. And, it's one that is pretty familiar because that is how we tended to sort of think about elections. So like when a Democratic candidate doesn't get elected, like Hillary Clinton did not. She did get elected, but you know what I mean. The talk was about how Black women did not support her, but they very much did, but they may not have at the same sort of rate. And so the frustrating part for me is that, when Black people become the face of something that is a national problem and also not even really proportionally a Black problem.
So do you guys find that your families are hesitant, or are they following in your footsteps? For those of you who have taken the vaccine, are they following in your example and taking the vaccine as well? And I'm directing that to the two who have gotten it. So Dr. Fields Gilmore and Dr. Nurse LaShawn, are your families following your lead?
Not at this moment. They're not following my lead for many reasons. It's their reasons, their decision, like we've been talking about. We really just want to shift perspective so they can make an informed decision on their own. It's not because I got it, you got it, but I know it's they're thinking because they know me and what type of person I am. So I know they're thinking about getting it, but they have not, like my husband, my sons, my mom, people that are close with me, my siblings, they have not yet. One of my sisters have gotten it, but the other four have not gotten it. So no, they're not following my lead as of right now. I think they're watching and they're just actually gathering their own information, which I'm encouraging them to do that because it's based off of your decision, that autonomy that was taken away from us. I think that's why we're blinded in some areas or we're blocked in some areas because it's like, you're not going to make me do this. It's not what, it's what I want to do. So it's at their own pace. So no, for me.
Okay.
I totally agree with you, LaShawn. Is that you're not going to make me do this, but husbands. So, but the rest of my family, my extended family, most of them have gotten it, and I'm so proud because I didn't, honestly, like I said, I'm not gonna sit here and go back and forth with you on this. I'm not. I got it.
Absolutely.
I'm gonna
I
tell
agree.
you why I got
Yep.
it, and it's
And that's it.
available to you. Go get it if you can. And so, like I said, I was proud of my family members who did get it, and my family members who didn't get it. I'm not doing that.
I hear you. I hear
Yep.
you. So the question that I have that I actually wrote down while you all were talking is getting this vaccine creating false hope in the people that get it. Are they thinking that they're going to be super immune and that they're never going to get COVID? Is it creating false hope for those folks who actually get it?
One of the things that I was careful, and I'm careful to constantly say, and I'm in Texas, right? So our wise, sage governor at midnight, we know the mask mandate is gone in Texas. Okay.
Mm-hmm.
So one of the things that we don't have to wear a mask anymore. Everything's back to normal in Texas at midnight tonight.
That's why I'm not visiting.
Right.
Okay.
Right. Don't come. I mean, really. But one of the things that I said when I got the vaccine, I put it when I posted it, and I say it all the time. You still have to wear your mask. You still got to wash your hands. You still got to do social distance. You still have to communicate and get involved with people only who are in your little pod, in your little circle that you know and you feel comfortable and you know that they're keeping you safe. And, it's kind of like that unsaid agreement. Okay. And so I constantly say that you still, and I have my patients, they're getting the shot. And one of my patients was a couple today. They were like, well, I don't want to come see you in the clinic yet, doc, until I get my shot. And they was a cute little old couple. I said, okay, that's fine. They didn't want to come face to face. And so, I mean, by and large, even though our most wise governor decided that everything could go back to normal here tomorrow, a lot of people are not comfortable with that. They're not ready for that. And they are, I mean, a lot of people, a lot of businesses are still going to do the mask thing, even though they don't have to force it by law anymore. But you can still have policies within your business and say, hey, you can't come in here without a mask. He said that, you could still enforce that policy for your own individual business. So you still have to adhere to all of those things so that we can, like Dr. Noble said, we need to get to herd immunity.
Mm-hmm.
Yeah, and I think that was the biggest mistake that we as a country made in this pandemic, and it starts from the top all the way down. We were short on going hard in the paint in regards to masking up, social distancing, and hand hygiene. And when you make such hard statements about not masking up, don't go buy a mask, and something that was very basic and just common sense principles, you're going to find it very hard for individuals to trust you when it comes to the science regarding a vaccine that was produced in less than a year. And so now you have governors all across the country that are sitting up here rescinding this notion of basic principles. Singapore and some of these S-hole countries were able to get the vaccine, was able to get COVID-19 under control without a vaccine by doing basic things of masking up, hand hygiene, social distancing. The vaccine is not going to be an end-all cure-all, but in conjunction with those three measures, we can sit up here and get through this. So when people do get vaccinated, we just shouldn't return to normal, quote unquote. We need to continue all the same things. So I do get concerned about people getting vaccinated and feeling like they can just do whatever. That's not the case. And we all need to continue this and understand that it's very plausible that we will need to get a booster shot or an additional shot in 6 months to a year. And this is going to be an endemic, something that we should expect to see year after year until we all can get this under control.
So you said something about a booster shot. What you said?
That this could be an endemic, meaning not a pandemic, but an endemic, meaning it's going to extend for a prolonged period of time. And that as we start to get more and more information about the vaccine, we don't know what our antibody levels are going to be 6 months to a year from now. So as our antibodies start to fall as it relates to the vaccine, we may have to get another booster or another shot to get our antibody levels back up to be able to do those things that we like to do. be with our relatives, be in large gatherings. So it's very plausible that a year from now, we're going to be talking about getting another COVID-19 vaccine, or maybe 6 months from now, having to get another COVID-19 vaccine booster to build back up our immunity.
And so I know that we have a question, and I just have a quick add on to that. So if you got, say, the Pfizer, then you should only get the Pfizer booster, or could you get the Johnson & Johnson booster, or how does that work?
We don't know.
Well, right. Okay.
What it
That's a good question, though. I mean, Laureen, that's a really good question.
That's a good question.
That's a really good
yes.
question.
Absolutely. It's a great question that we don't know yet, but the main difference between these vaccines is basically that the delivery system. It's basically like taking one Uber versus another. So like, you know, are you going to take like the Uber that's like a Honda Accord, or are you going to take like the XL, which is basically what the Johnson & Johnson is? It's a whole, like, it's interesting. The way that I equate Dr. Noble's point is that masks, distancing, and social and hygiene, that's like a bus service. You need a bus service that works really effectively if you're going to have a good public transit system. The COVID vaccine is more like a shiny new light rail line. Like it's awesome, and it works really well, and it works really well for people. But by itself, it's not going to necessarily get you what you need to create an effective system.
Gotcha. Okay, so we have two questions, and I'm gonna try to get through them really quickly. So if I could have someone answer this one really quick. Does this extreme hand washing and sanitizer use make us more susceptible to viral and bacterial sicknesses?
No, you washing your hands.
Well, Joby's like this, and you said no.
No, you washing your hands. No.
Okay.
Well, it depends on, as far as the hand sanitizer, alcohol versus antimicrobial. There's a difference with that. You want to make sure you're using the alcohol sanitizer when you're using a sanitizer, 62% or more. But washing your hands, absolutely not. That's something that's, to me, that's just, I'm with Dr. Fields. That, no, you won't. You'll save your life and others.
Okay.
It's a great question, though.
Okay.
It is.
So this is the last question that we're going to have time for, because we got about 3 more minutes. With the vaccine being created so rapidly, what shortcuts were taken? What are the safety risks that can be identified? I don't know who wants that.
Joby.
Yeah, we touched on this briefly, but here's the good thing: there weren't any shortcuts.
Right.
So there, basically, the way that you would normally do this is that you study animals. Then you study humans for vaccine safety, and then you study humans for vaccine effectiveness. So that's what you normally do. You normally study those in sequence. They stacked all those so that they basically ran all of those studies, all 3 phases of those studies at once. That was how they were able to get it created so quickly. The big safety risk for that is that we don't have nearly as much data on the long-term effectiveness of the COVID vaccines that we have currently. That is the trade-off that we have made for creating a vaccine with that level of speed.
Thank you for that. So we have about a minute and a half left. So I can go to each of you really quickly for your closing remarks, if that is appropriate. So let me start with Nurse LaShawn.
This was amazing. I love it. Community is amazing, and collaborating. And I learned something while sitting at the table as well. But the key thing is changing our perspective, changing our position so that we can be informed and really make the best decision for ourselves, and not so much of allowing our history to block us, but take us to the next level as relates to information, education, and executing that. And just because we get the vaccine, educate yourself after. It's not going to cure us, but it is going to help us. And so information and education is very important. Let's do it together.
Thank you for that, Dr. Joby.
I appreciate it.
Really quickly, well, we're going to run out of time, but go ahead.
Okay, just thank you for allowing us to be able to talk openly about some of community concerns. That is really important. It is where it is to talk about the ambivalence that doesn't get processed. Tends to lead to negative behaviors. And we don't want that. We want you to be able to talk openly about what your concerns are and what your misgivings and reservations are. Those are really important to talk about, not to just convince you of our,
Yes.
what we say is right, but
Right.
but for what you say is valid.
Good.
That's more important.
Good. That's good.
Thank you so much. Thank you so much, Dr. Fields Gilmore.
I just want to say thank you for having me. I'm so glad everybody was asking questions and allowing us to answer your questions and allowing us to tell you our stories and give you our examples so that you can have more information. Because again, I had to gather my information to make my decision. Continue to seek the information that you need to get to a point where you can make a decision for yourself about what you want to do for your health and for your family and for your community. Thank you for having me, and pray for Texas.
I already told you we're about to send you some blessed oil or something.
Yes,
something,
we are.
so you can pray for your governor.
Okay.
Dr. Noble, it's on you.
Maureen, thank you. Thank you to the panelists. People, community out there, just know that we got you, we got us. Take whatever vaccine that is available to you. If you don't take the vaccine, that's your prerogative, but everybody, mask up, wash your hands, socially distance, and together we can get through this. It takes a lot of vigilance. We got to remain vigilant throughout this whole ordeal. I know that we're all tired, but we can do it together. So continue to mask up, wash your hands, and socially distance. And if you get the vaccine, get whatever vaccine you can get.
Well, thank you guys so much for hanging out with me. Thank you so
Thank
much.
you,
Thank you.
Thank you.
I probably threw y'all off, but I just have to tell the audience, I totally respect everybody on this panel. I thank you for your expertise. I am not convinced as of yet, but I'm away for y'all's friends to call me at the medical. What did you say? The Mahari and the stuff?
Mahari, the house.
But in the meantime, I'm going to keep washing my hands. I'm going to keep myself masked up. And I'm going to continue to make sure those around me are doing the same. And I'm going to wait for that herd immunity, because if they get it, I ain't got to. So with that, thank you guys so much for joining me. Thank you to the audience for your amazing questions. And we will see you next time.
All right. Bye-bye.
Thank you.